Hello to our U community and welcome to this interview being recorded today, Tuesday, August 31st, 2021. I'm Sean Wood, Communications and Community Outreach Manager with the University of Utah Communications. And today we are discussing the U's mandatory vaccination policy that was announced last week. My guests for this conversation are Vice President for Student Affairs, Lori McDonald, and Director of the U's Student Health Center, Dr. Mark Fitzner. Thank you both for joining me today. We'll be jumping right in with what we believe are some of the most common questions, frequently asked questions that are top of mind for our students and broader U community. So, Dr. Fitzner, the university announced last week that the vaccinations will now be required for all U students. Why is this measure being implemented at this time?
I think, as many people have realized, there was a state law that said that COVID vaccinations couldn't be required while they were under emergency use authorization. And I think it was a week ago, last Monday, the FDA gave full approval to the Pfizer COVID vaccine. And with that, the university then decided to require this vaccination.
Can I jump in too? Thanks, Sean. I think that we continue to learn so much about this pandemic, about what is needed as communities, both large and small, to take measures to try and protect one another, to slow the spread. We often hear that, to really try and end this pandemic as quickly as possible. And I know that I want to acknowledge that there are a lot of feelings, there are a lot of emotions, there's a tremendous amount of opinions around this idea of a vaccination that came about quickly in our lifetime. This was very quick, but so it's natural to have a lot of questions. What the university knows, we're so fortunate to have an academic medical center with us and have such great experts giving us advice on how to be able to come together in person for classes and everything that we do in a university. And one of the tools, what I'm hearing is almost the most effective tool for us to keep doing that is vaccinating and having almost all, if not all, of our campus population vaccinated and protected. And I think that we need to be respectful of the fact that there are a lot of questions about this. And I know the university is trying to provide as much information about it as possible. We're trying to provide access to this vaccine for those who do want it and are seeking it out as quickly and as easily as possible. And we're using this truly as a tool to get back to this exceptional University of Utah experience that we know we can have. I am in awe of what students have been through in the last 2 years, and our staff and our faculty along with them. And so I want to acknowledge that this is a very charged situation, but we know this is a tool that is effective, and we have a lot of resources to talk about it and to provide it to our campus community. That's what I'll add.
And then I don't know, I think Shauna why we're requiring it, but I think it's important to mention kind of why vaccines are important in terms of helping control an infection and the spread of infection. I think if you've seen anything with the current news, when you have a large population that's unvaccinated, we get lots of variants. And so you're hearing about the Alpha variant, now the Delta variant. Now I think they're up to even a Lambda variant that they've identified as the virus is mutated. But if we can make sure that the vast majority of us are immunized, it leaves less of a reservoir for that virus to replicate and make more variants and can slow down the spread. So, if most everybody around an unvaccinated person is vaccinated, the virus has nowhere else to go. And so it's really important that by having enough people immunized, we can slow the spread. And, you know, I know a lot of students last year on campus, when they got exposed, were quarantined. And that's like a pain to be quarantined where you can't go out and do things. What's nice is right now, by the guidance, is if you're vaccinated and exposed, you don't have to immediately be quarantined. We're recommending at that point in time that you wear a mask indoors, do daily symptoms and make sure if you become symptomatic to get tested, and then get tested routinely day 3 to 5 after that exposure, so we can know and control things. So the vaccine will protect you, protect the campus community. And if you found quarantine particularly painful last year, it's a great time, a great way to not go into quarantine after an exposure or classroom exposure or things like that.
All right. Thank you both for all of that information. So Mark, you mentioned that, you know, last week, the week before, the Pfizer vaccine was FDA approved. So is that the only vaccination that's out there that the university will accept while asking students to adhere to this new policy?
The immunizations requirement policy is available to read on the Student Health Center website. If you just go to our main website at studenthealth.utah.edu and then click on, I think it's immunization requirement, it'll take you to that page. So it'll explain all the details of the requirement. But no, we don't just accept the Pfizer vaccine. Many people throughout have gotten Moderna or Johnson & Johnson. So we'll accept both of those vaccines. You would need to be fully vaccinated with those vaccines, which means 2 doses of the Pfizer or the Moderna, or 1 dose of the Johnson & Johnson. Now we have international students that come to campus and may have started getting a vaccine series in another country. We will accept a full series of those vaccines as long as they've been approved by the World Health Organization. So for example, AstraZeneca, Covishield, Sinopharm, BIBP, and Sinovac are all vaccines that require 2 doses. And if they completed the series in their home country, we will accept that. If they only got 1 of those shots in their own country and then came to here, we would recommend that they get a complete series of 1 of our vaccines, the Pfizer, Moderna, or Johnson & Johnson. And that's based upon CDC guidance on what people should do if they've only had a partial series of those other vaccines. Basically, it's because they're already here, they can't go and complete the series, and we don't have it available here. So they're recommended to go ahead and complete it. They should just wait 28 days, I think, from the vaccine that they got in another country before starting the series here.
Great information, thank you. So for those, so we've reported out that we have our own campus vaccination numbers among our student population. Can you give us some information about how the university is getting that information and that data that we're pushing out?
Every state in the country has immunization registry. So if all of us who were school kids and went to school, probably not me because it didn't exist when I was in school, but when you start going into school and you get a shot at your doctor's office, those shots were then put into the state vaccine registry to keep track of them. So, and then over time with electronic medical records, as we get shots that way, it automatically goes into the state vaccine database. So that registry's been around for a number of years. Because we've always had an MMR requirement, and when we got our electronic medical record, we added an interface with USIS, which is the name of the vaccine registry in the state of Utah. And so when new students come into our system, we automatically query it and look to see if they've had their MMR vaccines. If they have, it'll download them to us and we'll say, okay, you're compliant. And so a lot of students who've started recently probably never even knew anything about it because they automatically comply with it. And then our system will, when we have eligible students or students that are going to school, we'll periodically requery monthly to see if they've gotten other vaccines, so we'll have them available to us. So when COVID vaccines came on, the federal government required all those vaccines that are given to be put in that registry within 24 hours. Pretty strict guidance to have that done. And so if students have gotten a vaccine within the state of Utah, more than likely that vaccine will be in the state registry and then will come into my system. And that's where we were reporting the numbers that we had. Now, what I've noticed from looking at people who have uploaded some vaccine cards to us so far is occasionally we may have one dose from the state registry and then the other dose we didn't get. Sometimes it's due to someone's name not matching exactly. When they got their second dose, their name didn't match exactly and it got reported differently. And so we didn't get both of those records. And then early on, if you remember how kind of crazy it was in December and January when we started giving it, a lot of places didn't have electronic systems up and running. So they were hand entering these into USIS, and that created some difficulties, I think, as well. So, so most students should have their data. If they don't have their data, and we'll talk about it later, we'll explain how they can go ahead and provide that information to us.
Okay, Mark, we're going to stick with you for one more question.
Okay.
So I would imagine that many people have this same question, particularly those who have had COVID-19. They may be thinking that they already have immunity to the virus. Could you talk about that? Do these students still need to get vaccinated if they haven't, but they've contracted the virus?
So the CDC guidelines, I think when the vaccines came out and they were looking at kind of how things worked with the antibody response to the vaccines and people that have had it and haven't had it and just were vaccinated, they've kind of realized that when you get the natural infection, how your body responds is not the same across the board. So some people may have a higher antibody level than other people and whatnot. And so the idea is if everybody gets the shot, which standardizes a dose to stimulate your immune system, it'll give you adequate protection. It'll give everybody kind of the same level of protection. And so they've looked at studies of people who have had it, and by getting the vaccine, it boosts them up to have what they consider more of a protective amount of antibodies to prevent the infection. I've also had some students ask me about, well, if I had it, should I get an antibody test? And then will that be good enough? And I'm like, no, the antibody test doesn't really tell us anything. It could be positive, but based upon the level, nobody can tell you like, oh, this level is going to be totally protect you and this level won't. So it's better to go ahead and follow the guidance to get the full series and potentially boosters as we hear more information about that. But that would provide, I think, the best protection for them from COVID infections. And we know that vaccine has a very good efficacy in terms of preventing hospitalizations and deaths. And every vaccine has a wide range of those values of what will do it. We all get a flu vaccine every year. Some years the flu vaccine isn't nearly as good as what the numbers we're seeing with the COVID vaccine. So I think it's really important that we get the vaccine because we know that from the data that it helps prevent the hospitalizations that we're seeing right now and the deaths.
Thank you, Mark. So Lori, let's come to you. So with any policy, the rules and guidelines are in place. So could you outline what the possible consequences are for students who may not be compliant with this policy, and what steps are involved? What steps do students need to take?
Right. Thank you very much. So yes, our requirement is for the demonstrating that a student has received the vaccine. And as Mark said, there's a lot of detail what that means to be fully vaccinated and that type of thing on that website, the student health website. Or they need to indicate an exemption. And what we're looking for is for this to be completed by the end of September. The consequence for not complying is that a hold will be placed on the registration record for students who we don't have information on. And that means that they would not be eligible to register for classes in the future, like spring semester. And so we do put that hold on the record a little bit before when registration is open, just to remind students if they hadn't been maybe getting all of these notices that they do have something they need to take care of. And when they do demonstrate compliance by demonstrating the vaccine or the exemption, the hold does come off of the university record.
And it shouldn't be a surprise to them that they have holds. Just so how it works typically with just the MMR vaccine, we typically would wait till the first couple of weeks of the semester, and then if people are non-compliant, they get an email saying, "Hey, you're not compliant. You haven't set this up. You're in danger of having a hold placed." And then we place that hold. And so all the hold is doing at that moment in time is preventing the next semester's registration. So if we're placing holds at the end of September, they've got the whole month of October, and depending on when they actually register for classes in November to complete the requirement. So it should be similar to what we've done before with the MMR vaccine. It's just with now additional vaccines because students will have to comply with both of those right now.
So building off of that, Mark, and maybe you could just explain it in a different way. With the COVID vaccine, there's a four-week period between vaccinations, depending on which vaccine you're taking, I believe. So, and as Lori outlined, this needs to be completed by September. A lot of students may be stressed that there's not enough time to complete this. So what can you tell us about, say, I've had the first vaccine within, in the coming days, I get the first vaccine. What does that mean moving forward if that 28 days extends into October or longer?
Okay, so for what happens with most, we'll use the MMR example that I've talked about before, because it has the same window. You have to wait 28 days before the next shot. If somebody gets a letter from us that says they're non-compliant, and they come and get that first MMR, or that say they got an MMR somewhere else and it gets reported through USIS, and then we verify it, they'll get another email saying that we verified and their record is complete. There's nothing more they need to do. But we also let them know if you only received your first dose, you're only going to be compliant for the next 28 days until your next dose is due. And so while we'll place a hold, say we placed a hold on the end of September, and then 2 days later they got their first COVID vaccine, and that's the only vaccine they needed, that hold would come off, and it would be off for 28 days. And then 28 days later, we would periodically reapply holds to make sure we're capturing those who haven't completed the whole series. So then the hold would go back on. They'd get another letter saying, "Hey, you haven't complied yet with the full requirement." And that email will then list like, "Okay, your MMRs are in place, but you're missing one COVID." So they would know which ones they need to do. So yes, if they get started late, they'll be able to go through the whole process, and then we'll place holds again to make sure that they've completed the vaccine series, basically.
Great, thank you. So we can imagine that students coming to campus this fall, learning about this new policy, they're going to fall into several different categories. So let's start off with students who have not been vaccinated yet. Who should they contact? Where should they go to get a vaccine?
So I think there's multiple places they can get a vaccine for campus, and I think if they go to the coronavirus.utah.edu website and then click on vaccinations, it will take them to a page that will talk about the vaccination opportunities on campus, with events being held where they can get it. It also has information about my office. We have the Moderna vaccine at the Student Health Center. They can go through our patient portal and schedule an immunization appointment visit. We're doing these by appointment only. Can't do walk-ins like we have done in the past, just because there's just too many people that could potentially be in our waiting room at the same time. So they can do that. If if there are students who aren't on campus that often, or it's easier where they live in the Valley, they can go to vaccines.gov. And based upon a drop down, you can select which vaccine you're interested in getting. So I want a Johnson & Johnson, so I'll just have the one shot and be done. They click that and it'll show where it's available and which pharmacies have it, and then go get it. If they want the Pfizer vaccine, they can do similar things, click a box, see who's offering it. And there are places even close to campus, at Walgreens, I've seen other Smiths, all the pharmacies that are carrying all the vaccines will have those available. And it's just good to remember that vaccines are free. The COVID vaccines are, wherever they get them. So there's no worry about cost. And so those would be the opportunities I would suggest to look at. Probably the easiest and the quickest way to get it. I think some of the healthcare, like University of Utah Healthcare, Intermountain Healthcare, also are offering them, but I think that for the most part, they're relying more on pharmacies in the Valley to give the vaccines right now.
All right, thank you. So I think the next category would be our in-state students, that population. Say that they've received their vaccine. What do they need to know? What actions do they need to take?
So I'm hopeful that most in-state students, I will already have their records if they got the vaccine in Utah. Like I said earlier, there may be, some data things that we might not have got the records or not. So I'm hopeful in the next couple of days we'll be able to send an email out to all those students and the students who have already submitted information to us, because other students have been uploading COVID cards all summer. We can send an email to them saying, hey, we've got all your records, you're good. Again, if it's only one vaccine, they might have to get another one, but for the most part, we've got your information, you're done, don't worry about it, you're good to go. So that would be what I would tell the Utah students. And they can always go to our website and our patient portal. And if they click on the immunizations page, like they were going to enter the information, they can click on a button. I think it's the green button on that page, and print out a copy of what we have on file, and they can look to see which vaccines we've gotten from the state. So that they may say, oh, look, one of my COVID vaccines is missing, I need to enter it. And then they just drop down under that, find the COVID vaccine it was, enter the date, and then upload a copy of their vaccination card, and then we'll verify it and then tell them everything's good.
Fantastic. Is that the same process for out-of-state students?
Yeah, out-of-state students would just go to our patient portal, log in, they'll go to the immunizations page. There's instructions explaining how to do it. They'll just kind of go down the page, find I think we have it, we're still changing some things right now, but there's a required box for all students, and under that there'll be MMRs and the COVID vaccinations. They can enter their dates and then go to the upload page and upload a copy of their immunization cards for their MMR and their COVID card. And so I think it's good for out-of-state students, before you do it, get all that information or have it ready, take pictures, digital pictures. We prefer PDFs, but we've seen all sorts of things. Upload it, and then we'll review it. And then after we've reviewed it, you'll get an email that we've reviewed it and taken care of things. If there's any questions we have, students typically will get an email to their email account saying, hey, there's a secure message on our patient portal, and they just log back onto our patient portal and read the message, and it explains in more detail than the standardized letters saying, hey, we're missing something. It tells them exactly what we're missing. Occasionally a student will upload a record that doesn't have their name on it, so it's like, is it really your record or not? So we need to have that information on it. And occasionally, how things, you take a picture and it's blurry and we can't make out the dates, so we'll sometimes ask you to resubmit it. But it's that process. So but it's fairly easy to just do that and send that stuff into us.
So when students possibly get these communications from you, is it coming from are those emails? What email should they be looking for? Is it
always look at your university email? I think it's been, I think since I've been the director here since 2008, it's always been read your university email. So I think a lot of people just don't pay attention to it, but I think it's very important, especially this year, to look at that for frequent communication of what's going on. But they'll get that. like I said, we do secure messaging, which is a way of messaging through our electronic medical record. But that typically saying that you have a message from us there will come to their U email with a link to go back to our patient portal, log in and read the message.
Great, thank you. So to recap, the students on campus that may be receiving these emails, out-of-state students specifically, possibly international students, and students in the state of Utah who we may have a question about their record. Is that accurate?
Yeah, so the email will detail everything they need to do. So for this semester, I mean, students who have already started school have already gotten kind of an email explaining the MMR requirement, what they needed to do. So students who are verified, everything's fine, will get an email about that. Students that are what we call non-compliant, that haven't submitted everything, will get an email telling them what they need to do and reminding them again of how to do it. And they'll even get a copy of what we have on file, or what they're missing, I guess, or what we have on file and what they're missing of the 2 required vaccines. And then they'll know how to log on and get it taken care of.
Thank you so much. Lori, this is probably a question for you. So the state law outlines that there are exemptions that students can take advantage of if they feel that they cannot or should not be getting a vaccine at this time. So could you outline that process and what students need to know?
Yes, thank you. Pursuant to that Utah law, we are providing the 3 different types of exemptions. There's a medical exemption, a religious exemption, or a personal exemption. And on the immunization webpage for student health, there is a link to that form. For medical exemptions, there is a need to upload documentation. For religious and personal, there's an optional statement area where they might explain that, but that is where they would indicate that is their exemption indication. And of course, then there's some verification that that is who they are. If students are minors, if they're under the age of 18, they do need to indicate that a parent or guardian who will then be the one to complete that exemption request. And if Mark, correct me if I'm wrong, but some students may declare an exemption, but change their mind and decide they're ready or might be able to obtain the vaccine, and they can still then get the vaccine and upload their information.
Yes, I'm sure if somebody uploads something and they already have an exemption in the system, we'll probably want to check with them and see what's going on. I mean, we've had people with prior older religious exemptions that have subsequently gotten vaccines, and we typically then remove that exemption at that point in time. But we are going to have students for the COVID vaccine, if they've had a prior exemption to the MMR, they still need to go through the process for the COVID vaccine to declare which exemption they would like. And the other thing I would say, if people are making the decision not to get the vaccine and are requesting exemption, I just want to make sure that they're aware of the testing resources on campus, that we do asymptomatic screening tests weekly, or you can have it done whenever you want, but we recommend having it done weekly. That way you'll know if you're positive, and if you develop symptoms at all, please don't come to class and schedule a test so we can control this and not have it spread on campus.
Great. Lori, could you just clarify one more time? If a student is seeking an exemption, action must be taken. They still need to go to, could you direct us to that resource again? And they do need to take an action saying, I'm getting an exemption for 1, 2, or 3, or whatever it may be.
Correct. Thank you, Sean. Yes, at studenthealth.utah.edu, under the immunization page, there's an FAQ as well, and there is a link to the exemption form that is just a quick online form, and they do need to actually go in and indicate the exemption and save that.
And Sean, the link to that is also in every letter that we send to the non-compliance students. So the link will be there as well. And it's also, I think, it is on the portal because I did that yesterday. So it is on the patient portal as well for them to complete. They should not email it directly to the student health center just because it'll get overlooked that way. It needs to go through this formal process where we get those sent to us and then we can enter them in. So do not email them to us. Use the links that are on the website for the exemption.
Thank you for all of this information about the vaccine policy, but the question remains about masking on campus. Is that going to be mandated either this fall or even in the spring of 2020? Lori, could you talk to us about that?
Yes, what we do know is that masks are another one of those really good tools that we've learned is incredibly helpful to protect those of us, those who might be carrying the virus who don't know it, and certainly those who are symptomatic and all this. This is a tool. Again, according to Utah law, we are not, this is not a requirement or a mandate on campus, but just as we know that these tools are really helpful, we are asking our campus community to follow the guidelines, and the Center for Disease Control is saying wearing a mask while you're indoors, regardless of your vaccination status, is a really important tool. And so that is what we are asking. And of course, the other thing we've learned through this whole pandemic is things change. They can change quickly and can change over time. And so I think my answer is really, we want to look at whatever the current guidance is at the time. And I think we're learning that the masks are going to be a useful tool for preventing everything. I mean, the flu and lots of airborne illnesses, I suppose, if that's the correct way of saying it. And I think I've heard our senior vice president, Dr. Good, talk about the it will probably become like when we wear a jacket in colder weather. You bring your jacket with you. I think it's really going to become ubiquitous that we carry a mask, and there are times during high transmission where we wear them all the time, and there will be other times where many people will feel more comfortable wearing them, and there could be really good reasons for it. So we want to be very respectful about this and just encourage our campus community, regardless of your vaccination status, to wear a mask while you're indoors, during class, in laboratories, at the library. We know this is another really good tool.
And I would say, I think in some of the outbreaks that we've seen too, even outdoors, if you're very, very, very densely packed, it's also a good time to wear a mask. And outdoors is better because there's more airflow around you and that sort of thing. But we know this is airborne, and so wearing a mask is a way to protect you, especially if you're worried about it. And I get a lot of questions from people who are worried and what should I do? And I'm like, well, find a mask that's comfortable, number one, that you like to wear it and works and covers your face, doesn't fog your glasses, all that kind of stuff. And then you might even think, now that there's a better supply of other masks out there that are like N95s that you can buy now, if you're uncomfortable, buy a better mask that you can wear, so you'll feel better protected from all these illnesses. Because I don't know, I've been a doctor for a very, very long time, and the last little bit was probably the healthiest I've been because we've been wearing masks all the time and I've not gotten sick. And so I think it's really important to think about that experience that we had because we all wore masks in terms of the spread of illnesses and things like that.
Thank you. Lori, coming to you again. So we've been discussing students, how this student policy. Could you walk us through what, if anything, this means for our faculty and staff on campus?
Excellent question. We certainly are very strongly encouraging vaccination for our faculty and staff. In terms of a requirement, there are still discussions with leadership, with our state leadership, with other schools, how that might be implemented. So it is still under discussion at this point in time. And of course, Mark and I are really focusing on the student requirement, but I'm sure there will be more information to come in the future about that.
All right, thank you both for this conversation today. So we'd like to remind everyone, if you have questions or concerns about this, you can go to coronavirus.utah.edu. Mark, will you remind us of your student portal that students can get that information from?
If they just go to studenthealth.utah.edu, there's large icons for the patient portal, for the immunization requirement that they can click for more information.
All right. Thank you both. We really appreciate this conversation, and we'll be communicating more with our community in the coming days. So thank you, everyone. Have a good day.
Thank you.
Thanks.